Hello, everyone. This is Amy Hagel, Shine Liaison at Senior Connection Center. In today's edition of Medicare Monday, we have Michelle, Shine Volunteer and Local Coordinator Assistant from Polk County, covering the topic of Medicare and VA benefits. So let's get started with the basics. Michelle, can you please provide a general overview of what VA health benefits are?
I'm happy to do that, Amy. Um, VA health benefits is healthcare provided mostly in VA medical centers, outpatient clinics, and nursing homes. Healthcare from non VA facility providers is covered on a very limited basis, and people who are eligible for VA benefits must apply to be enrolled in the VA benefits program.
Okay. And who is eligible for VA health benefits?
Certainly, veterans are eligible, but the benefits depends on one or more factors. First of all, existence of a service-connected disability and exposure to related exposure to chemicals related to the service, a veteran's income. The VA assigns veterans to a number of 1 to 8 in priority groups, depending on the factors previously identified. Veterans' costs depend on their group assignment, and those with the lowest priority have the highest cost. So it's income and asset based as well as service disconnected and exposure based.
Hmm. Okay. So somebody that's a veteran and has receives VA benefits, can they get Medicare and VA benefits at the same
They
time?
certainly can, but they need to understand that Medicare pays for Medicare covered services or items, and Veterans Affairs pays for VA authorized services or items.
Hmm.
So they do not work together. They're not concurrent benefits. They're entirely separate. So people who have both Medicare and VA benefits can be covered under either of these programs, but never both at the same time. VA benefits do not typically work anywhere but VA facilities, and VA benefits do not wrap around Medicare, unlike TRICARE or TRICARE for Life, and we'll explain more on that later.
Okay. So do VA benefits and Part B, how do they work together?
They really don't. VA benefits uh, really are similar to Part B benefits, but it's an accessibility option. So many veterans do enroll in Part B despite its cost. They would have to pay the Medicare Part B premium, which currently is $148.50. Um, Premium penalties and enrollment restrictions apply if someone delays the Part B enrollment. Veterans may want to have the flexibility of getting health care outside the VA system, which would be the purpose of getting Part B premiums, paying the Part B premium, and having Part B benefits. It's accessibility and convenience. Low-income individuals may qualify for Medicaid or through the Medicare Savings Program to help pay the Part B premiums and/or some cost sharing.
Okay. And what about a Part D?
That again is a veteran's choice, an individual choice. Again, many veterans do opt to enroll in a Part D plan. It's creditable coverage, what is received at the VA. So a person can delay enrollment in Part D without penalty and outside usual enrollment periods. Because it is creditable coverage, a veteran can enroll in Medicare D at Part D at any time, really. There are no premiums and no or limited copays for prescriptions. VA coverage is comparable to having Medicare drug coverage with extra help. Some veterans join a Medicare Part D plan. When I counsel, I recommend that they do that because it doesn't the Veterans Services provide medications usually by mail. That's the least costly option for veterans. Well, obviously, if you have an infection or you need immediate medication, you're either going to pay out of pocket, or if a Part D plan is available to you, then that will defray those costs. People who live far from the VA facility or pharmacy or do not want to use the VA doctor to get a prescription enroll in Part D, and people who want the flexibility of filling prescriptions at retail pharmacies or find the VA formulary too restrictive. And there's many other reasons, but primarily it's accessibility and convenience.
Hmm, some excellent advice. Well, thank you so much for joining us today in this video series of Medicare Mondays. So please contact us, the SHINE program, for anything related to Medicare, including Medicare fraud and abuse. Our SHINE volunteers and Senior Medicare Patrol are here to help. You should call us at 1-800-963-5337. Specify your county, and you will be connected with your local SHINE SMP program. Well, thank you for joining us, Michelle.
Thank you.